This week we're going to dive a little deeper into the specifics of the anatomy of incisors and canines. What I would really like you guys to do, and I encouraged you in the last videos, is to go ahead and download the BoneBox app. It helps give you some quizzes. It helps kind of see the tooth in 3D. Just making sure that you truly understand the anatomy of these teeth, because this is what you're going to need to work on. And as the gingiva is covering the root and the patient has a deep pocket, you need to know how to move around that tooth in order to remove all of the debris on the tooth. So here we go. Let's start with incisors, chapter 12. Our objectives in this PowerPoint are to identify the particular anatomic features of the incisors, and also by the end of this, the student should be able to compare a maxillary central incisor with a maxillary lateral incisor, and same with the mandibular. This is just going to be the maxillary that we look at first. All right, so anatomy of incisors. We have 4 maxillary incisors and 4 mandibular incisors. So we have our, always going to try on my pen. Let's see how it goes. There we go. All right, so here's our lateral. This is our central, and our lateral. Okay, central, here's our midline, right? Going right down the middle here. So we have 2 on the right side, 2 incisors on the right, 2 incisors on the left, and this is the maxillary. Remember, the upper jaw is the maxillary. So this is number 7 on the right, number 8, number 9, and number 10 are our maxillary incisors. Then we have our mandibular, and we have a lateral here, a central here, a central here, and a lateral here. This is tooth number 23, number 24, number 25, and number 26. Okay, our midline again is between our 2 centrals, 24 and 25. Okay, so we have 4 on top and 4 on bottom. All are anterior, and they're all succedaneous, meaning that they replace primary teeth. The maxillary incisors are the most prominent teeth in the mouth. That's what we're going to be able to see. Okay. Incisors are shovel shaped. So if you look at this tooth, you can see, so here would be where your handle is, and then this would be the arm of the shovel, right? This would be the back of the shovel, and then here's our shovel, and that's to help shovel food back. They also have very sharp incisal edges. Remember, these teeth are designed to cut, so they cut the food and they shovel it back into the mouth. They also have wider cervical areas. The crest of curvature is in the cervical third of the crown, and you can see that here. Very big curvatures here on the cervical third of the crown. Curvature of the cervical line is greater on the mesial aspect than on the distal, and we'll see that a little bit later on in this PowerPoint. The maxillary incisor has the greatest curvature of the cervical line of any tooth. Okay, so let's move on to our maxillary permanent central incisors. So this is tooth number 8, or teeth numbers 8 and 9. Okay, so I'm just going to write that here. Teeth number 8 and 9. This is using the universal system. Okay, so we have number 8 on the right side, and number 9 on the left side. All right, so we first see evidence of calcification at 3 months of age. So right when that baby is moving from their 0 to 3 close, they're moving into that 3 to 6 months, that's when these teeth are already starting to calcify. Then they calcify, or they continue to be constructed in the jaw and erupt around 7 to 8 years of age. The root is finally completed usually about 2 years after it has erupted, so about 10 years of age, okay? Now this is a question that is often asked, and that is, which tooth is widest mesiodistally? Okay, so what that means is it's going to be wider from here. Oh, trying to make a line across. Here we go. Okay, it's going to be widest this way than it is from the facial to the lingual aspect. Okay, so again, the maxillary central incisor is the widest mesiodistally of any anterior teeth. Our labial appearance, that's this facial appearance, right? Labial because it's by the lip, is less rounded than the lateral incisors. It's a fairly symmetric crown, meaning, very similar if you were to fold it in half, okay? It's nearly straight on the incisal edge, and if you look on this, it's straight on the mesial side and curved on the distal side. So what I want you to see is see how it's straight here, but then here it's a little more curved, okay? And what this does is it causes this to be almost a 90-degree angle here, okay? Now, potential anomalies for the maxillary central incisor, not very many. We're going to have potentially a short root, an unusually long crown. Sometimes you'll see people with long crowns there, and then gemination. We talked about that previously. So the maxillary central incisors do usually develop normally, okay? Remember, our maxillary lateral incisors is generally where we're going to see more of the anomalies. But again, there are a couple anomalies that we need to be aware of, and that is, or a few. The most common is going to be short root and long crown. But we've also seen a tendency for germination in there. So I would say that's about the third most common, okay? So when we look at the labial aspect, we're going to see that it is slightly convex. It's pretty smooth. It erupts with these mamelons. So remember, mamelons are like the scallops, right? So that kind of helps it, they think it helps cut through the tissue a little bit better. They do wear after time. Then we have these developmental lines that divide the surface into 3 parts, and those are our developmental grooves, and it's just right in between all of those mamelon, okay? Facial view, also the distal outline is more convex than the mesial outline, okay? So again, this is just curving out more than it is on this side, okay? And then, like I said, the mamelon do wear down over time. So the maxillary central incisors are labial aspect continued. So we're still looking at the front of the tooth. I have the lingual here. I'm not sure why, but I did want you to see that the root is cone shaped, it's blunted, it's 2 to 3 millimeters longer than the crown. And the ratio does vary because remember, sometimes these roots are a little bit shorter, right? So flip these around and then you'll see, I feel like you can still see this on this picture. All right, here's our lingual aspect, which we did just get a little view of. The borders are going to be more rounded by the convexities, okay? There's one concavity meaning going in, and then a cingulum. So here's our cingulum, and I wish these pictures showed up a little bit better. Here's our cingulum here, okay? They may have 2 or more lingual ridges, and you can see in this one, this larger picture, that there are more lingual ridges. They may have a cingulum with a fossa. So here's our ridges, okay, and then this one up here shows a nice smooth fossa, right? Okay. Let's see here. A lingual fossa on either side of the cingulum, usually developmental grooves extending from the cingulum to the lingual fossa, and then the crown and root taper lingually. All right, so it's not sitting straight up in the jaw, it's tapered. Everything is kind of tapered to the lingual. Maxillary central incisors, the mesial aspect, you're going to see more of a triangular crown. The incisal ridge is centered over the middle part of the root, so it's kind of balanced. Here's our triangle. Try and draw it here. Okay. And then notice that this incisal ridge goes right over the mesial, or the central part of the root. The labial outline is going to be convex, that's right here, meaning coming out, and then the lingual is going to be concave. All right, that's that shovel appearance. The cervical curvature is going to be greater on the mesial surface, so that's this line right here, okay? Oh, so if you have a tooth in your hand and you're having a tough time determining if it's the right or left, look and see. Say there's a bunch of wear here and you can't see the sharper mesial angle. You're going to look at the curvature. Which side dips towards the enamel, towards the incisal edge more? And the mesial is going to go a little further down than the distal. All right, here's our distal aspect. Do you see how that curvature here isn't quite as great as it is on the mesial? Okay, it is still pretty similar to the mesial, so you just really got to look at that CEJ. With the incisal aspect, you're going to see that the incisal ridge is going to slope lingually. Okay, so you can see how it's tapering towards the lingual here. All right, the crown is going to be more triangular shaped, and the crown apex is on the lingual surface. Okay, so here is the apex. Okay, there we go. Okay. So just a quick review of key highlights. Remember that the maxillary central incisors, there's evidence of calcification when you're only 3 months old, that the eruption is at 7 to 8 years old, so you're looking at this generally in first to second graders. Root completion is 2 years after that, so generally around 10 years of age. The maxillary central incisal, or central incisor, is the widest distally, mesiodistally, of any other anterior tooth, so it's very broad. The maxillary central incisors usually develop normally, but there are a few anomalies that occur, and that includes an unusually long crown, a short root, and then sometimes you'll see gemination where the tooth tries to divide itself. Another highlight that I want you guys to focus on is the marginal and incisal ridges. They're very rounded convexities that border that lingual fossa. Okay, you can kind of see them on this picture here. See how this is kind of rounded here, rounded up here, and it's just, it almost looks like it's a wall built up over the fossa, like it's protecting the fossa, and that's just the sides of the shovel to scoop things in. Okay, so these are the marginal ridges here. Marginal ridge, marginal ridge. Okay. All right, let's move on to our lateral incisors. Here we go. So this is evidence of calcification begins at 1 year, so right around the time a child is walking. At 8 to 9 years old, so you're looking at second to third grade. Root completion is going to be 2 years after that at 11 years. Okay, so root completion isn't until 11 years. Think of how many times a child is maybe riding their bike or learning how to ice skate, learning how to rollerblade. This is a very active time, right? So if they jar that tooth and it starts to say that it comes out and it's put back in, the dentist is going to go in and place some all of a sudden I'm drawing on a blank of it, but calcium hydroxide in there for that root to completely form, and then they'd have to complete a root canal on it. But that's if a student loses their tooth. All right, but that's pretty common with these. Generally it's going to happen to the central incisors because they're the more prominent teeth, but I have seen it also happen to the lateral incisors, and it's because that root isn't completed. So when it erupts, say this whole apex here is gone and this is really wide here, and what that calcium hydroxide will do is just start to seal this off. It stimulates the cells to help complete the root as soon as possible to give it reattachment. So again, at 11 years old, we don't have to worry about that quite as much because that's when our root is completed. The maxillary lateral incisor is much smaller in dimension, except for the root length. The individual, so it's going to be a lot smaller than the central incisor. Individual development does vary. Remember, this is a tooth that varies more in all the anomalies, except for the third molar is the number 1, and then the laterals are number 2. Okay, so really understanding that this is where you're going to see teeth missing. You could see pegged laterals, which are really small laterals. So this tooth is very prone to all those anomalies. The features are much more prominent than the central incisors, and you're going to see, even right here, the the mesial aspect, this is going to be our mesial, it's not quite at 90 degrees, it's a little rounded, but then see how much more this distal aspect is sloping. So again, there's more curvature than the central incisors. It's rounded incisal ridge. It's got a rounded incisal ridge. Rounded angles, both medially and distally. So I just showed you that on the previous slide. These are more rounded than they are on the central incisor. And then the root length is greater in proportion to the crown length than that of the central incisor. So we still have a really long root, and it's going to be much longer than the crown. Okay, so the root is often 1.5 times the length of the crown. That's a lot. That is anchored in there. But just think of what it's doing. It's biting and tearing into food. So it needs to be anchored in there nice and strong. All right, let's move to our lingual aspect. The mesial and distal marginal ridges are very pronounced. So this is our mesial. And how do I know that? Many things. Here's this edge here is a little a little sharper than this edge. But we also, if you remember from the previous chapter, this root tip is going to almost always, remember our general rules, tip to the distal. Okay, so we know that this is our mesial. And this is our mesial marginal ridge here. And this is our distal marginal ridge. Okay. The cingulum is going to be pretty prominent. That's right here. There is a tendency to form a deep developmental grooves within the lingual fossa where it joins with the cingulum. The lingual incisal ridge is better developed than that of the central incisor. So this is all right along this line. Okay. And another thing you're going to notice is that the lingual fossa is going to be more concave and circumscribed than the central incisors. So this is going to be deeper. Okay, a deeper fossa. Now, what happens often, because this is a little more scrunched together, you're going to find a pit right here. And why is that significant? I'm going to put a P, I guess, a pit. And that is significant because decay can occur in that area. So when we find a pit, first we need to make sure that it's not dens and dentae. This is a common tooth for dens and dentae. Remember, that's where it's tooth within a tooth. So it invaginates and begins to develop a tooth inside of the tooth. But if this is just a deep pit, then we need to seal that so that the patient doesn't get a cavity in that area. And then we would need to monitor that sealant throughout their lifetime to make sure that it continues to be protected. All right, our mesial, distal, and incisal aspects. A mesial, it's similar to a small central incisor. The only exception is that the root appears longer. Remember, it's 1.5 times that of the crown of the tooth. The distal aspect is the same as the mesial, with less curvature at the cervical line. That's our general rule. So if you look at this, where this dips down, that's our mesial view, and where this dips down, it's not quite as far down into the enamel. The incisal aspect, it resembles that of the central incisor or a small canine. The cingulum and the incisal ridge may be large. Okay, so sometimes you'll see a really big cingulum here. And then more convexity compared to the maxillary central incisors. Convexity meaning going out. So I just want to make sure I clarify this before we move on. So you can see there's more convexity here. Okay. Okay, so let's talk a little bit about the maxillary incisors root. The maxillary central incisor usually has a straight, thick, cylindrical shaped root. I mean, it is, if you ever see one extracted, it is conical, it's like straight, pretty easy to identify. The maxillary lateral incisors are going to have a more narrow root, but remember that root is 1.5 times the size of the crown. So the root is as long as that of the central incisor, but it is much thinner on the lateral. The apical part of the lateral incisors root often curves distally. I showed you guys that on a previous slide, and then it ends in a sharp apex rather than that blunted central incisor. All right, maxillary incisors, the pulp cavity on the central, which are our upper pictures here. We have one root canal, one pulp chamber in the coronal portion, 3 pulp horns. Okay, so here's one here, one here, and one here. Okay, so a mesial, a distal, and a central. And the central horn is going to be much shorter and more rounded. Sometimes it's a little harder to identify because it is a little more flattened. Okay, so here's our one canal, and it's going straight up this root. Okay, now our lateral, very similar in that it has one pulp chamber, it has one pulp canal, and usually one form, sometimes 2 pulp horns, a mesial, and a distal. This is kind of showing 3, but often you'll just see 1. Okay? All right. Oh, I believe that wraps up the maxillary laterals. I also just want to mention that we also see what's happening with the maxillary central incisors. So often something that happens is we get patients get a diastema in there from that low frontal attachment. Okay, so remember that happens between the maxillary central incisors and usually not the mandibular. And the mandibular, if the frenum is too high, it's usually going to do some gingival stripping and cause recession. Okay, let's move on to our mandibular incisors. And at the end of this unit, the student should be able to compare the maxillary incisors and their mandibular counterparts to identify an extracted incisor, which unfortunately we don't have any teeth to look at, but if you are using your bone box, you should be able to see the difference between the incisors. And then to recognize the normal and deviated anatomic forms of the incisors. So let's start with our central incisors. Remember, these teeth only oppose one tooth. When they're biting together, these teeth are only touching the maxillary central incisors in a proper dentition. Okay? So much like the maxillary central incisors, they begin calcification at 3 months. Now these usually are done a little bit earlier, calcifying at 6 to 7 years, because they aren't quite as big, right? So they don't need as much time to grow in there. So you're usually going to see this at 6 to 7 years old. So this is first grade, okay? I always like to do grades because when my patients are coming in, you're usually asking them what grade they're in, and even if they've lost theirs, maybe their friends, they've lost theirs already, maybe their friends are starting to lose theirs, and it's kind of an exciting time for kids. Root is usually completed 2 years later, so at 9 years of age. These are the smallest teeth in the mouth. So like I said, it is the smallest tooth in the mouth. It's derived from 4 lobes, 3 labial and 1 lingual. It's the most difficult to identify whether it's right or left, and that's because they're very, very symmetrical. If you look at the curvature here and here, there's not a lot of difference, so it's really tough to see. So factors that you can use to differentiate it is that the disto-incisal angle is slightly greater than the mesio-incisal. And when they say slight, they mean slight. Okay. The distofacial line angle is more rounded than the mesiofacial line angle. Okay. So if you see that in this picture, so if you only have a crown, that's the best way to tell. The cervical line crests slightly to the distal side. So it's kind of cresting more right here, which is very slight to the distal side. And then the line between the endpoints of the distofacial line angle is shorter than the line between endpoints of the mesiofacial line angle. I also am just going to say that the root does just slightly tip to the distal sometimes. All right, from the labial aspect, we're going to see a very smooth facial surface. The gingivo-incisal outline is almost straight up and down. Okay, so gingival, incisal. Okay. The height of contour at the incisal third on both the mesial and distal surfaces. Okay. All right, and then the lingual aspect, we're going to see the cingulum is much smaller than that of the maxillary incisors. You can see that right here. And there's no tubercle extensions. Those are generally found on the maxillary laterals. There's no pits here, and the fossa is very shallow, hardly any fossa. All right. So I just want to go back to the height of contour at the incisal third. I just want you to know that that is the height of contour when you're looking at the labial aspect. Okay. Then when we're looking at the incisal edge, it does tend towards the lingual half of the tooth. So you can see this incisal edge here is just a little more on the lingual than it is on the labial. It does slant labially from this edge. Excuse me. Incised edge shows wear. Incisal edge shows wear on the facial aspect. Remember, those maxillary teeth are kind of on the outside here, so they're going to show wear on the lingual, and this you're going to see it more on the facial aspect. Okay, the incisal view does show the wear. Mandibular lateral incisors. Now we're moving next to our laterals, and this is going to be teeth number 23 and number 26. Okay, they start developing a little bit later at 4 months. They're going to erupt about the same time as the maxillary central incisors, and the root completion is going to be about the same time also. Excuse me. Okay. Differentiation between the mandibular lateral and central incisors lateral are that they're bigger and wider and longer. They are wider mesiodistally and longer gingivo-incisally. So they're going to be bigger this way and this way to their central incisors on the mandibular. Has more prominent anatomic features on the lingual aspect than on the central, slightly more convex and concave, greater facial curvature. We're going to see this in a little bit. And endpoints of the mesiofacial line angle is farther apart than those of the distal facial line angle. So here we go. More rounded appearance, both mesially and distally, so it's not as squared off here. Okay. The developmental grooves are going to be deeper, so you're going to see a little more of a groove here. Remember, we need to make sure that those are nice and clean. They can be fairly deep sometimes. The height of contour at the contact areas is at the incisal third on the mesial and the distal. Okay, so here and about here. Okay. Distal contact is slightly more gingival than the mesial contact, and you can kind of see that contact is going to be a little bit further down. Remember, you're going to notice that the canine is going to have it a little bit lower also, so the height of contour, so it's where those two meet together. Mandibular lateral incisors, the lingual aspect, the ridges are more developed. Still not quite as developed as the maxillary, but you can see here's the mesial marginal ridge, here's our distal marginal ridge. The fossa is going to appear more in here, and that's all in this area. Enamel tubercles often extend into the fossa, so you might get a tubercle right here. And then a lingual pit is very rare, but more often present on the lateral than it would be on the central. So, you know, if you're asked to compare the central and the central doesn't have a lot of anatomy. Okay, so if it's talking about any pits or any marginal ridges, anything like that, the more prominent is going to be on the lateral incisor versus the central incisor. Okay, here's our mesial and distal and incisal aspects. The mesial proximal view and the distal proximal view, you're going to see a contour on the labial and lingual surfaces higher at the gingival third. Okay, so here's our contour. All right, thicker at the lingual incisal ridge and narrow at the labiolingual. Okay. Cervical curvature is greater on the mesial than on the distal. Okay, so which one do you think is your mesial and which one do you think is your distal? All right, which one is greater here? So this is going to be our mesial view, and this is going to be our distal view. You know, I challenge you to kind of outline it, to draw it yourself, because if you're tracing it, you feel it more than what I see. I feel a sharper peak when I'm drawing it than when I'm actually just looking at it. Then the incisal aspect, you're going to see rounded general appearance, developmental grooves appear deeper, and then it appears rotated on its axis. Do you see how it's kind of going down like this? And that is because if you think of of the mandibular arch, it's curving. It's not as broad as the maxillary because the maxillary teeth are going to come outside, right? So these teeth need to turn quicker, right? And that's what this is doing. It looks twisted on its axis because it needs to curve a little faster than those of the maxillary. All right, let's talk a little bit about the mandibular incisor roots. The root of the mandibular incisor is usually pretty straight. The root of the lateral incisor is going to be slightly wider, thicker, and longer than the central. So again, bigger tooth, bigger anatomy, right? The apex of the lateral incisors root may point labally or distally, so towards the lip or towards the distal. The proximal grooves are commonly found on root surfaces, giving the appearance of a double root. So remember, if it's a deep groove or deep concavity, it's going to look like it's trying to divide. All right, wrapping up our incisors chapter 12. We're going to end with the pulp cavity of the mandibular incisors, and the pulp cavities of the mandibular central and lateral incisors are pretty straightforward. They're pretty simple. They usually have 3 pulp horns and a single root. The root canals of all 4 of the mandibular incisors are similar to the maxillary counterparts. They're straight and narrow and really have very little variation. The mandibular lateral pulp canal is going to be a little bit larger and show more variation, of course, than what? Than the central, okay? Because it's bigger, wider, stronger, all right? It's rare for either of these to have 2 root canals. So if the patient does need a root canal treatment or root canal therapy, they can expect it just to be 1 single canal. All right, if you have any questions, please let me know. Thank you.